today. Assalamu alaikum warahmatullahi ta'ala wabarakatuh. It is my great honors to be with you today and give these insights and these principles of one of the important topic nowadays in research about systematic review and in medical research. In general, I may introduce myself to you. My name is Hadi Miskin. Currently, I am the head department of obstetric and gynecology at University of Bisha at Saudi Arabia. I obtained my primary degree in medicine MBBS from the University of Jazeera, MD obstetric and gynecology from Sudan Medical Specialization Board. Then I am lucky to find my way to Harvard Khan School of Public Health, where I have been awarded Master of Public Health there. And also I have a fellowship for Foundation of Advanced International Medical Education and Research from FEMA International Institute or joint program with in Shams University. I'm also a tough fellow toward the Health Policy Fellowships. And also I am the membership of Faculty of Public Health at UK. And also recently I obtained fellowship from the American College of Health Data Management. And currently I am doing my fellowship also in the Institute of Healthcare Improvement at Boston in the US. So I am so happy to be with you today, and you are all welcome for these sessions. And thank you for the Medical Club at University of Jazeera and University of Bisha, and special thanks for Abdulaziz for his contacting and also for arrange these workshops. We are going to start on time if you never mind. I'm going to start. Is it okay with you? Okay, Abdulaziz, have you any comment or you want to do any introductory word or something like that? Abdulaziz,
Yeah,
welcome. Do you want to say some things about these workshops? Okay. I can start. So I can start if you never mind. Okay. Actually, this workshop for systematic review is very important for all of us. And it is a cornerstone of evidence-based practice in all the field. Whenever you are in medicine, public health, social science, or any other field that relies on census research, understanding systematic review is very important, very essential for all of us. So you are so welcome in different specialty where you are, you are welcome, whether you are in any field related medical field or in social science also is also you are welcome. Public health, you are welcome, and any other related field also you are welcome. And so I like so much the multidisciplinary approach in research, and this is very important because whenever you are in any field, you should to know how to do systematic review. So together, I will try to talk in very simple language, very simple way, and feel free if you have any questions. Abdulaziz, you can pick up the question from the chat, and I can also pick up from there, and I can answer your question whenever you there. We'll try to finish at about 1 hour exactly, because I think all of you are eager to watch the match of today, Milan and Barcelona. So I will be there, but also I will request from the medical club to arrange another workshops for advanced concept on this issue. In this session, we are going to define what is systematic review and distinguish it from the other type of review. We have another type of review, and now I think it is obsolete and it is difficult to find this way for publications. So the future of the research in systematic review of the day, and also today we need it badly. So systematic review is very important for us, but also we are going to highlight other type of review. Secondly, understand the case step in conducting systematic review. Besides that, also we should to recognize the importance of systematic review in the evidence-based decision makings, and also identify common challenges and the best practice in systematic review methodology. So I can ask, what is systematic review? Systematic review is a rigorous structures method for synthesis existing research. Existing research, this is very important on specific research questions. So we should to be so specific for this issue. And it is very important for you to understand this issue, okay? So I think whenever you are, we need this structure way. Okay. So existing research, primary research on a specific research question, this is very important concept and we should be considered. So systematic review in general, it involves clearly define research questions. So this is the first step. We have to clearly define the research questions that I want to answer. And also, the second thing is comprehensive and reproducible research strategy. This is very important. Comprehensive, because I want to catch all the relevant or the possible included research. It's very important. Reproducible research strategy is very important, because if someone you want to use this research strategy, this will be doable. It's very important. The third thing is critical appraisal of included study is very important, and I have to know and I have to be able how to criticize and appraise the study. And I think also, lastly, systematic data extraction and synthesis. This is very important. So there is some key features I have to know. One of these, transparent and reproducible method must be documented so others can replicate the process. Because, and this is the value of scholars and research. If someone you want to do the same research, I think you will be able to do it. So transparent and reproducibility is very important. Also minimize the bias by use pre-buying criteria to select and evaluate the study. You have to, and here, don't to include the study and to exclude the study without systematic approach, okay? Comprehensive search for the multiple database and sources to capture all relevant literature is very important. And by the end of the day, the biggest systematic review, it is about, would be about 40 to 50 studies, and the smallest will be about 4 to 3 study. All are acceptable. So in this regard, we should do differentiate between the systematic review and the narrative review. Systematic review and narrative review is very important to differentiate between them, because if you know how to differentiate between these things, I think it will be good for you, and at the same time will be it will be useful. And by the way, uh, your study will be systematically merits and systematically يعني, also acceptable. So narrative review is now it's traditional review, but systematic review is a new one, and all people now consider to do this type of systematic review. So it's very important for you all to differentiate between uh, these two uh, these two types of review. So in the features for example, for methodology, in systematic review, I have very strict predefined protocols. Protocol is very important, while the narrative or traditional review is less structures and it is more subjective regarding the methodology. For the search strategy, systematic review is exhaustive documented search, while here is selective and often not documented at all. Bias, high bias, minimize selection bias. And bias control here is controllable, and in the systematic review, it is not acceptable, and it is not expected to have a bias here, while control here is very low in the narrative review. And regarding the purpose, answer a specific research question. Here, we're going to answer very specific research questions, while in the others type of review, especially the traditional one, we provide a broad overview to the topics, what is written there and what is there, and so on and so on. So it is very important. It's very important for you to differentiate between these two types of review. Have you any questions? If you have any question, I am ready to answer. If you have no questions, we can continue. Okay. There is any question, Abdulaziz?
لا يا دكتور، إلى الآن ما في أي سؤال.
Okay. If there is any questions, you are welcome. No questions, ما في مشكلة.
مجمعينها إلى آخر المحاضرة.
طيب. اوكي. لو في حاجة ظهرت if any question is a chat, you are welcome. Okay. لو في حاجة مو واضحة we can also clarify it at the same times. So systematic review versus meta analysis. It's very important يا جماعة to differentiate between them. Systematic review, all the meta analysis is systematic review, but not all the systematic review are meta analysis. The meta analysis, it is a statistical method used within the systematic review to combine results from multiple studies quantitatively. That's systematic, the statistical method. We can do another session on meta-analysis and to clarify more about this. But now we concentrate on the basic one is systematic review. Not all systematic review include meta-analysis, but all meta-analysis include meta-analysis should be a part of systematic review sometimes. So we have many steps for conducting systematic review, and this could be according to the Harvard Chinese goals. This could be classified in nine items and process and 3 phases. And for examples, phase 1, phase 2, and phase 3. And this will be covered during these versions. In phase 1, here we have a plan to review, and this phase include identifying the need for the review and the develop review protocols. If there is no need we cannot do something without needs. Every effort will be considered for the need. So we should identify the need for the review and develop a review protocols. This is the phase 1. Every successful or a good systematic review should start with phase 1. In the phase 2, we have to conduct the review, and this is a practical phase, and this include 5 steps. Number 1, develop literature search strategy, study selection, data extractions, quality assessment, and data synthesis. This is very important to consider as a conduct when we are conducting the review. And the last phase, phase 3, is report and disseminate the result, report and recommendations, apply the evidence to the practice. This last one. We will cover these steps during these workshops. So, when to identify the need for the review, this is the core of the problems, because if you have no need, no meaning to do that. So, determine exactly the research question you are asking, this, which is called formulating the study question. Check if a review has been done before, and if so, if there is a need for an update or not, because you may need to update it. Most of the systematic review now updated after Corona pandemics, because they need to update and possible links or possible influences of the Corona pandemic if there is. So, and also because of the new evidence are also going on, so every 5 years can repeat it. Check if the review has been done before, and also this is very important, and search for the published and ongoing systematic review before the application of effort, because there may be ongoing systematic review. So we will talk about also the registration of your review, because someone they are running systematic review on the same topics and register to the database. So general database as Medline and MPS is a good source to check there. Cochrane library and also Cochrane database for systematic review, and here and Prospero. All of these can check there if your topic are now running or something like that. Also, in this phase, phase 1, also we should consider also critically appraise the existing review. You have to be able to appraise the existing one, and to ask yourself some questions. Was the study question clearly defined on population or not? And there is intervention or exposures. There is a comparisons, and also outcomes and study design, which is called traditionally or as a PICO, PICO questions. And also this should be considered. So you will hear a lot of it during these sessions. And also, was the search strategy adequate and appropriate, and where there is any restriction on language, publication status, or publication date, also you should to check it. And also, where is the preventive, where the preventative step take to minimize the bias and errors in the study selection, in the quality assessment process, and even in the data extraction, there is any thing. This is a critical appraise what we mean. So where appropriate methods were to use for data synthesis, and also do the author's conclusion accurately reflecting the evidence that was reviewed. This is very important to be considered in this stage 1 before even to start your study. And if a good review already exists, I reviewed many databases and I found a good review exists. I have to ask myself some questions. Where is the author specific enough? If the result in a subdomain are interest, for example, subpopulation, I may repeat it the same systematic view, but I may use high versus low risk populations, consider the age, for example, another age, another genders, maybe done on the females. I want to do it in the females, ethnicity. Also, there is any other subpopulation can work on it. Also, a specific exposure. For example, there is a dose, there is new protocol, and dose has been changes. There is new treatment combinations. For examples, exercise in adolescents has been also considered, and also you have to also consider specific outcomes. For example, myeloid versus other leukemia, triple negative breast cancers, for example, and or throughout you have to keep asking what is the further insights your analysis can contribute to the study topics, because if you are able to answer this question, so you can do it. I can go to the further steps and for formulation of clear research questions, and this could be considered as step one. So use the PICO framework for the clinical, especially for the clinical questions, and PICO it is for B for population, I for intervention or exposure. I mean C for comparison, and O for the outcomes. For example, if I want to differentiate between the intervention and exposure, for example, if I give a drug A, for example, paracetamol for the treatment of treatment, مثلا, say for the headaches, this intervention, or exposures, or headache and stress. Stress here is exposure. So I have to differentiate between intervention and exposure. For example, if I want to give you here examples, I can say that this is example of a good example of the big question. In adult with hypertension, this is my population. Does daily monitoring, this intervention, all that involved in telemonitoring projector programs, these are as considered as the intervention groups compared to standard care. This standard care, this has been what are going on in the hospital. This will be considered as improve as comparisons. Improve blood pressures, this outcome. Improve blood pressures, this would be our outcome and should be considered. Okay. Is it clear this research question? Because research questions is very important step you are going to start. Next times, I am so happy to do or to conduct a such workshop for specifically for research question. And by the way, yeah, I am now, I have a workshops on how to design a specific research question for the specific groups. For example, I have one for the woman health in Sudan during conflict, how to design, how to address the woman health issue by specific people questions for this issue. And I am happy to help in this in these workshops, and any groups also they want to do such work, I am happy to do it. The second step is to develop a protocols. Protocol is very important. Pre-registers the review in Coghrane or Prospero to prevent bias and to prevent repetition at the same times by defining inclusion and exclusion criteria. This is very important to be considered. So the second step, and it is very important, is to consider the protocols. Also, it is very important to develop it specific specifying during that specifying the methods reduce the risk of reducing bias and cannot select study based on the result and which scale اللي هو كاركون ان كاركون اوت، يعني ما تحط الحاجات كلها في الحاجات اللي انت دايره والحاجات اللي انت you want to select and want to select. If you must modify the protocols, protocol amendment should be clearly justified and documented also in the registration. So end of modification, do your modification. And also in the list one, the list steps, I have to or sorry, in the third steps, I have to conduct a comprehensive literature search. Where I search, you have to search in a multiple database like PubMed, Embase, Cochrane Library, and also use control vocabulary like MISH and empty or any keyword, and include gray literature. For example, conference abstracts, theses, preprint study, and also Google Scholar could be considered as a great literature source. So comprehensive literature is very important in order to take or to recruit most of the literature published in this issue. Also, when you are developing the literature search, we should to be comprehensive and transparent. Transparency, Jama, it is very important in research, and it is good to work with the librarians. And librarians is very important. This professional and this cadre is very important. And by the way, a systematic review traditionally has been developed and has been had been teaching with the librarian himself. Also determines, before that, determine the database, as I said before, and this according to the type of study. For example, toxilines, if I have working on the toxins, I have to go to toxilines. This database very important. All the toxin studies are there, and also contact experts in the research area. For example, if you are running a reproductive health area, I should to consider someone expert in reproductive. And also, it is very important to review reference list before that and specify inclusion and exclusion criteria or based in the PICO questions. And finally, you have to determine the key where you are going to use. The step 4, screen and select study by using the Prisma, which is called preferred reportings items for systematic review and meta-analysis. For reportings, Prisma. Prisma, it is the cornerstone of the systematic review, and there should be 2 reviewers independently screen titles and abstracts, then the full text. Firstly, I have to screen firstly for the title and abstracts, and then I have to screen the full text. When I came to the selection of the study, this steps is so important. I have to describe clearly inclusion and exclusion criteria. Criteria should be flowed directly from the review questions and record each step of your selection process and reason for exclusion, and analyze excluded study in sensitivity analysis. These very important steps. And here we have a Prisma flow diagrams, and this is a unique one in the systematic review. And I have to create my Prisma in 4 steps. For example, identifications. I have to identify through database all the possible studies, and also if there is additional record identified through other source should be also included. Record after duplicate removed, also what the numbers and what's the number of record screening during screenings, and record excluded also is very important. Then I will follow to the eligibility steps, which is based on a full text article to be assessed for the eligibility, and full articles also to be excluded with the reasons. Any reasons, I will show you some of my literature review here to if I found times, because we have very strict times, and if I have enough times, I will show you some. Then included the study, I have to mention it clearly that I exclude number of study. And this is an example. For example, here I found all the number is there, and Prisma Jama is very important, and it is an essential steps to be Then if I include here, like here, RCT final analysis include here 6 study. What I do by these 6 studies, then I will work on this 6 study, use the standard form to collect study characteristic, for example, design and sample size and so. Then the key findings, what I want to do, outcomes and effect size and so on this in the data extractions. Also assess the risk of bias by cognitive risk bias tools for RCTs. If I have randomized control trials, I have to use cognitive risk bias, these tools. And also we have Newcastle Ottawa scales, these for observational study. And these are famous and widely used tools for risk of assessment. I will show you examples of this. Step 7 synthesize the findings. How can I pick up or how can I make my the synthesis and synthesis the result for the narrative descriptions, descriptive summary for the meta-analysis. If the study are homogeneous, I have to do meta-analysis. In the step 8, I have to report and disseminate the result and follow the PRISMA guideline for the transparency and publish in a peer-reviewed journals or present conference. This is very important for us. Importance of systematic review. It is very important as an evidence-based practice. After these disseminations, I have to publish my work because it is important for us and important for other professionals to use your finding as well. So it is very important for systematic review because it relies and it provides and generates evidence-based practice because it helps clinicians and policymakers make some informed decisions. If you, for example, if I run or if I conduct a systematic review on the use of misoprostol, in the use misoprostol for the prevention of postpartum hemorrhage or treatment of postpartum hemorrhage. Then I conclude that misoprostol is very important for us, and there is evidence shows that it is very effective in the preventing postpartum hemorrhage. So, Ministry of Health should, as the policymakers and the clinicians, should to conduct this or should to consider this evidence. Identified research gaps. Also, through systematic review, I can identify any gaps by highlighting where more study are needed. Also, this could be for those who are going to develop or to conduct randomized control trials or primary study. The gap will be very clear, and also reduce redundancy because unnecessary duplication of the research is very important. Because if you did this one, no need to do the another's also the another's study or the another study while I am doing this systematic review. So it is very important to consider all this issue while I am conducting this systematic review. Okay, is it clear? Is it clear, يا جماعة? Anything to be considered, to be clarified? Okay, I can wait for you for half a minute. If you have any questions, just post it here in the chat. I can answer it because we rush heavy flow of informations, and I think it is important for you. It's important for you also to ask questions and to ask answers. Okay, I think the organizers share with you Google form in order to register. Registration is very important for the. I think to receive your for receiving your certificates, and also for us here if you want to do more analysis for those who attend this activity. If you have no questions, we can go forward for the next one. Okay, I have very few slides, and after that I can share with you example of our recent yes, there is a questions انه how كيف تختار الريسيرش عشان نسوي لها systematic review. Study selection يا جماعة is very important. This is a good question. تمام. You can select your study based on what? Based on the BICO question. Based on BICO questions. So BICO questions, if it addresses the same populations, the same intervention groups, the same comparison groups, and the same outcomes that you are registered in your protocols. So if any study matching your selection criteria that you mentioned in a BICO question, this is good for you to be included in your review. And by the way, you can also you can review it regularly. You can change in the selection criteria, and you can also change in your protocols whenever it is needed. Okay. So please feel free, and if you have any questions. الرابط ما بيفتح يا ابني. check الرابط ماله. في سؤال هنا بيقول لك انه الرابط is not الرابط بيفتح، لكن حاول انت تغير ال جوجل فورم وكده. This content either created nor endorse Google form report. Taking the owners of the form if you think this is mistakes. Review no longer accepting response. Okay, it is no longer يا جماعة accepted response because I think عبد العزيز لو في طريقة عليك الله افتح الرابط خلي الناس تسجل، لأنه شكله أيوة لأنه شكله احتمل العدد وكده.
يعطيك العافية أبو، الآن فاتح يقدر يخش. بس في سؤالين يا أبو، في سؤالين لك في الشات.
أيوة جود. سؤالين في الشات. اوكي I can طيب السؤالين how can you do the Prisma. Prisma يا جماعة والله يا أخي this is very important, and I think it's very important at the same times, and it need another sessions, but I will try to give you some trainings in this in very few minutes. I can do it, دكتورة صفية. لكن I think عبد العزيز next times we need to conduct workshops just for BICO question and for the Prisma designs. لكن في موقع محدد, and there is certain websites for doing the Prisma, and one of the most important is which is called Confidence. You can do it from there, and also you have Prisma designs. Also you can design. But anyhow, I can try to give you so. Okay, Fawzia تسأل asking about the tool to do abstracts screening. Yes, it's very important. By the way, you have at least for software, you have to have a subscription there, and you have to have access to do your systematic review. Screenings, this can do by evidence, confidence, or Rayan. Rayan, this is from Qatar. Also, you can screen for this, and you need two person to do this screens. Okay, so I will try to if I found some few minutes, I can open the confidence for you to follow me. Okay. I think there is last questions here in the chat. طيب. Yeah, this regarding the tools is okay. طيب, I have many challenges يا جماعة for conducting systematic review. And I have to consider also best practice in conducting system. The challenges like bias, publication bias, because negative results often go unpublished because this big bias questions. What about the unpublished data? Because if it is a negative, nobody can report it. So we miss a huge data by unpublished work. Also heterogeneity, because different study design makes synthesis purpose, it is difficult. If it's all of them are randomized control trials, it is will good. I will show you also our study in randomized control trials, how to do this. And time consuming can take months to years to complete. Also, it take times. So be patient, okay? For the best practice of conducting systematic review, and I think use librarians is very important because this improves research strategy quality. And by the way, this profession and these workers and these employees very important, Jama, and use uh, their experience into follow Prisma guidelines. This is a best practice. This ensure transparency and update review periodically because new evidence may be published at any times and may change your conclusion before study. Before we go further to practical review or to review some data, I can conclude that in systematic review are powerful tools for synthesis research evidence, and by the following rigorous method and research, we can provide reliable, unbiased summary that for practice and policy maker about our issue. So before we can take this takeaway, KA, this message for you is very important. Systematic review are structured, reproducibles, and minimize the bias as well. And also the key steps in doing this systematic review include protocol development is very important. Comprehensive searching is very important beside critical appraisal, and data synthesis is very important. Also, they play important role in evidence-based decision makings. Jama, it's very important, and we have to, everyone, we have to learn how to conduct and how to do systematic review. We have a course for this systematic review will be announced. Follow me. I will share with you my, I will share with you some further readings like Cochrane handbook for systematic review and Prisma statement also. I can share with you these slides later, and also follow me in in LinkedIn and in Facebook and something like that. And if you you may find me announce some or such courses, and I can do this يا جماعة بشكل أو بشكل تاني. And also it is very important to follow me. This is my LinkedIn. Follow here. I can use it. I can announce for some courses and some activities in order to you, in order to be to engage with me and with the activity. Okay, and also my I can share with you also the Facebook. It's where I can also share my activity. This one, follow me. Unfortunately, have no way to accept new friend, لكن follow أعمل following إن شاء الله we will together. طيب, may I ask Sophia, secure link for the website? Yeah. Secure for mention related to Prisma. That is good. Okay, Prisma and Ryan. Yeah, it's good. I will share it definitely. I will share it by I will share you. I will share it contact me also in the link it. I can share more data about it. But now I have a few minutes before we can leave this very valuable and very informative sessions. Can show you one of my recent for a systematic review. Yeah, this one. And this has been submitted for BMC. This one, this revise. Okay, this revise. Yes, I can share it with you now, and I can share with you also Ryan's and type. Okay, I will. Like before that, have you any question or to show, or before we start questions, I can share with you. Excuse me to share with you this one. So, yeah. Like this my new the recent systematic review. They about transforming medical education, the role of artificial intelligence in medical schools, and the need for the curriculum reform. This systematic review and meta-analysis of randomized control trials. My network here, many persons has been there. All of this are some of them are policy makers and colleagues and so many of them, and this multidisciplinary teams. And we have some people from Saudi Arabia, from Qatar, from Emirates, from Bahrain, and from I have my colleague from Harvard Chinese School, from US also, and many of them has been involved there. And by the way, sorry, I can say that this is research questions. How does the integration of AI-based education intervention, like AI tutorial, chat, GPT, AI-driven feedback systems, comparing with traditional teaching method or no AI intervention affect learning outcome and clinical skill equations, diagnostic accuracy, surgical performance, and student satisfaction among medical schools, residents, and healthcare professional training. This is a research question, and this is a research strategy, and you have this selection criteria, this data extraction, this quality, and this is statistical analysis. I can this I was sorry. This is the let me do. Yeah, this is the for example, let me to show you. Yeah, this is the Prisma here. This is the database, how to create the Prisma, and as the end, in the study including the review are 9, and there is 2, the data for the meta-analysis is not extracted. So we include in the assessment 62, and we exclude all of this because some are non-randomized control trials and different population addressing, and there is a wrong setting 6. So we report an analysis on 9 study. This is a Prisma, and we have very important to design this table for the study characteristic. All the study characteristic should be there, including other and years, country, aim, also AI intervention, population, outcome, settings, conclusion, trials number if there. If no, can say inapplicable, and quality assessment is very important. And also control and intervention and so on. Also, this is very important for you. And this forest plot is very important in the meta-analysis. Our topic today is not a meta-analysis, but we can show you this is very important in the analysis. And heterogeneity is very important also to do it. Either tables or either relative risk reported to be here. This publication shows a bias, and publication bias is here, which is called, if there is possibility of bias, we can do eager test here for this issue. And then it is very important to suggest some things about how to conduct this issue, this AI, or how to reform the curriculum, because I say that there is the respective application and curriculum reform for OI medical school here, like this here, and this I suggested it in a 4 stage, 1 to 2, 3 to 4, and so on. And this is lastly, and this is I think also the reference. I can say with you that this will be soon. This soon will be published, and inshallah, if you are with me, I can sorry, a link it is more mine. If you can search for me as Al-Hadi Miskins, okay? Al-Hadi Miskins, like this Al-Hadi Miskins. This is the link it. Yes, you can search for me here. Is the link it or in the face Al-Hadi Miskins, okay? Also, Al-Hadi Miskins. I will be sure this is me. This is me. I will, okay, share it with you, no problems. I will repeat it again. Okay, thank you. I think this is a good one, okay? This another try this one. Try this link. It will be inshallah. It will be where try the session strategy for that. Abdulaziz, we have just few minutes. We have very few minutes. We can review about, can show you something about confidence like this, and what is running now in our systematic view running now. So I will show you here. Yeah. I will show it. It is open now. But so let me to share this processing. Here. Yeah, is it clear for you?
واضح يا دكتور كثير.
طيب, this confidence, this one is very important يا جماعة for screening of your systematic review. I will show with you an example. For example, this one with Harvard Group, okay? We have تلقاه انت هنا in many steps. For example, بتبدأ step 1 import reference, title and abstract screenings, and full text review, and data extraction as the end. And it can import here. We can export from here. We can export the Prisma. After doing all these steps, I can do another session on this. And also now I will share with you, Dr. Safia, you ask about secure number for confidence, this secure number. I use confidence, not Rayan. Rayan also have been, but I think I advise you to use confidence. It is more structurable, more structures, and I am familiar with this software, okay? This, for example, this ones, and I can show you with you also another running. For example, this one. This is the one we use. We published or we also sent for publication. We say that we have included 9.1, and this is the Prisma I show you before. And also we have, for example, we have this one here, which is called also running project about this application of the progress testing in medical schools. For example, you have to finish this issue. We have 26 here study now اللي هو extracted for to be extracted. This as the in يعني in general this an very quick overview, and I think if you have any question we can ask it. If you have no other questions, if you want to feel free جماعة, feel free to share any idea, to share any questions. We have 4 minutes يا عبد العزيز ولا 3 minutes؟
دقيقتين يا دكتور، إذا ختمت خلاص لأن ما عاد في أسئلة.
ما في أسئلة خلاص. اوكي، في أي سؤال؟
شكرا لك يا سيادة البروف.
I have just I have 1 hour. I have just 2 minutes. 2 minutes for you can stop the record, and if you have any question you can copy it on. If you have any questions, just I want you to know where are you from? Where are you from? All of you from my university here in Bisha. Have you any others from outside Bisha? I am interested from those from to know your exactly where are you from. And I think we have a doctor with us. You have by the way, I like the Arabic translation for these workshops. مدخل إلى المراجعات المنهجية. والله I think this العزيز أفلحت شديد في إنهم really to choose these topics. مراجعات المنهجية is very nice يعني very nice. بعض مرات جماعة العربي is more very expressive, and it is very important يعني to consider Arabic and English at the same time.
يعطيك العافية يا بروف، شكرا لك.
Okay, if you have no questions you can say السلام عليكم ورحمة الله تعالى وبركاته. سعيد جدا اليوم أكون معكم في الورشة هذه. أنا systematic review, principle of systematic review, and I promise you further for another sessions, and till now I can say goodbye. Thank you so much, and are so welcome for any others.
شكرا لك يا سعادة البروف، شكرا لكم جميعا.